Venous disease in a nutshell. This video covers the presentation, causation, and treatment of venous insufficiency of the lower extremity and pelvis, more commonly known as varicose and spider veins and pelvic venous congestion syndrome. Hi, my name is Sanjiv Lakhanpal, and I am a cardiovascular surgeon and also the president and CEO for the Center for Vein Restoration. Today, I will be talking to you about venous disease in a nutshell. In the standing position, blood has to travel back up to the heart against a pressure gradient of over 100 millimeters of mercury. To facilitate that, nature has to come up with a system of ingenious mechanisms. One such mechanism involves strategically placed anatomical enhancements that prevent blood from falling down a certain column. These enhancements are called venous valves. The closer we are to the ground in our standing state, the higher the gravitational pull, and to counter that, more numerous are the valves. The second, probably even more important mechanism is the blood pumping action of the calf muscle when we walk. Remember, as I just mentioned, blood has to travel back to the heart against a pressure gradient. To facilitate this arduous journey, the calf muscle pump is recruited to work when we walk. This pump propels blood away from the feet, causing the venous pressure in the foot to drop below 30 millimeters of mercury when we walk. If this ambulatory venous pressure fails to drop below 30 millimeters of mercury, the condition is called ambulatory venous hypertension. Ambulatory venous hypertension in the lower extremity occurs in patients with valvular reflux or venous obstruction, either in the legs or the pelvis through the escape veins. This ambulatory venous hypertension is what changes the hemodynamic balance at the capillary level, causing tissue changes that lead to the signs and symptoms of venous insufficiency in the legs. These clinical presentations of venous insufficiency are classified by the CEAP classification. If the venous hypertension stays contained within the pelvis, that leads to pelvic congestion syndrome. These devastating symptoms of pelvic congestion include chronic pelvic pain lasting for more than 6 months, heaviness in the groin and vulvar areas, and painful intercourse.